living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Social factors such as income, education, and a person's environment contribute to major diseases and decrease life expectancies. What exactly does this mean, and what are healthcare providers in our area doing about it? Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned to learn how healthcare is changing to address social determinants of health. Welcome back to Healthy Living for Life. Joining us on today's show is Ben McGow, Behavioral Health Program Supervisor at Pureview Health Center. He's going to talk to us about social determinants of health. Thanks for being here, Ben.
Well, thank you for having me.
So what are social determinants of health?
So according to the World Health Organization, social determinants of health is basically associated with the conditions in which people are born, grow, work, live, and age. All of these factors are represented on a variety of different levels, such as key economic stability, education, social and community context, health and healthcare, as well as neighborhood and built environments. And to kind of put it in the context of the different areas or elements, economic stability might be associated with your employment, your food or your housing. Education is the different levels of education, from higher education or lower education, whereas an individual may have a degree or no degree at all. Also the language and literacy barriers that some individuals may have. Individual might be able to read or write, others may not. Other factors would be associated with the social community context. Example would be discrimination associated with an individual's race, gender, religious preference, or culture. And a person may have been incarcerated at some point in time as well. Another example of health and healthcare would be general access to healthcare resources. Individual may have a level of healthcare services in their community, others may not. That's provided at a further distance for travel. And associated with neighborhood and built environments, accessibility to good foods. That's one key thing. Crime or violence within their neighborhood. Also environmental factors that's built around them, and also the just general quality of housing.
That is quite a list. So talk to our viewers about some common social determinants that we might see in Montana.
So in Montana, we have a wide variety of rural areas. And within those rural areas, we have a clinic in Lincoln, Montana that we see where individuals have difficulty with housing, in addition to finding resources for food at different times of the year, good food to eat, to improve their living conditions, as well as transportation. Transportation becomes a big issue, especially if they need to reach medical services outside their rural community. That becomes a challenge for them to receive that care that they need, as well as prescription refills. And that's one thing that we've actually started within our own clinic is providing prescription distribution at these locations.
So give us an example of how you or your staff might identify a specific need with a specific patient.
Okay. So for us, we are a federally qualified healthcare organization. And what that means is basically we are a community-centered facility, and we connect with patients to provide them services, medical, dental, as well as pharmacy and behavioral health. That's wraparound services for those individuals that may come in to see us. And with that, it doesn't really matter if they have insurance or no insurance at all. And in addition, we actually provide that wraparound services to provide the best care we can and get in their treatment.
So give an example of a service you might offer a patient that comes into your clinic. What would you try and provide for them?
So a person may come in to receive medical treatment, and while they're being, I guess, evaluated by their medical provider, they may actually determine that they may have a mental illness or they may be a dependent as far as an addiction. And during that conversation with the provider, they actually have a warm handoff that they provide assistance to make sure that they provide that care of behavioral health or mental illness for treatment.
So how about a success story? Can you talk about a patient that really you felt so good about helping?
Oh, of course, I can give you an example. We've had patients where they may come in, like a father that may have children, and he may have just recently just come in just for a medical checkup. And during that conversation, there's a motivational conversation that we will have with them, with their provider, and they determine, well, they may actually need some other assistance because during the conversation they find out that they have lost their job. And in that scenario, they may have lost their insurance benefits as well. So we work with them to determine what the best, I guess, means of treatment is for their positive outcome. And we have case management team there on site that provides that assistance and service, as well as there might be some anxiety or depression associated with losing their job, where we actually provide a warm handoff to speak with the patient to see if they would be receptive to receiving additional treatment for behavioral health needs.
Are behavioral health issues and needs covered by most insurance carriers?
Well, that's one thing that's growing nationally. You'll actually see where more insurance companies are providing that service because there is a need that they have determined over the years. And you'll see where individuals may have a higher deductible or out-of-pocket expense associated with some of these services, or even with their insurance plan that they have selected. And whenever that's the case, then we work with them to put them on a sliding fee scale to provide that service that's needed.
And if they can't pay anything, then what does PureView do?
Again, we work with them on a sliding fee schedule to make sure that we can provide those services and make sure that they don't have that stress level associated with their insurance.
Thank you so much, Ben. That was great information. We're going to pause here for a short break, and then we'll talk with a social worker about what a hospital system is doing for social determinants of health. Stay with us.